Bismillahirrahmanirrahim. Assalamu alaikum viewers. This is Dr. Toqeer Abbas. Once again, I'm here at my clinic, Lahore. Viewers, today we are going to talk about blood pressure. Like when to check blood pressure and what is the normal limit and what to take and when to take and what should not to take. Especially, I always talk about young people. The issue with young people that should not be started in young people. So, so our first discussion is about can we cure the blood pressure without medicine, especially in young people who don't have diabetes and other major related issues with blood pressure. So here we have one patient. With permission, we are going to talk about why blood pressure happens. So we have a young man. Before he was a patient, but now we just want to discuss his story with you guys. He 2 months back, I think 2 to 4 months back, he was diagnosed with pre-hypertension, and he is going to telling his story, what exactly happened with this man, why he was diagnosed with blood pressure. And now, I'm telling you, now this man is totally stable. He is not taking medicine. He controlled his blood pressure by just this man controlled his blood pressure because I advise him to just stick with conservative management, like what to eat, what not to eat, when to sleep, and when to get up, and about exercise. So he is going to telling his story, what exactly happened with this man. So yes, please tell us what happened with you. Yes.
सर मेरा ब्लड प्रेशर की प्रॉब्लम थी, काफ़ी देर से पहले पुरानी थी। मुझे काफ़ी लोगों ने मेडिसिन की एडवाइस दी कि ये मेडिसिन खाएं आपका ब्लड प्रेशर ठीक होगा, ये ब्लड प्रेशर ठीक करेगा। काफ़ी डॉक्टर के पास गया, हकीमों के पास भी गया, मगर कोई फ़र्क नहीं पड़ा मुझे भी। फिर मैंने अपनी ज़िंदगी में टेंशनें बहुत ज़्यादा होने की वजह से ब्लड प्रेशर मेरा हाई रहना शुरू हो गया और मुझे ज़्यादा डर लगना स्टार्ट हो गया कि मेरा ब्लड प्रेशर इतना हाई क्यों होता है। तो फिर मैंने अपनी ज़िंदगी में से आहिस्ता आहिस्ता चीज़ें कम करनी शुरू की, नमक खाना छोड़ दिया। उसके बाद मैं वर्जिश पे आ गया, वर्जिश करने लग गया, अपने जिस्म की वर्जिश करता रहा और उसके बाद रूटीन वाइज नींद पूरी करने लग गया, शोर शराबे से दूर होना शुरू हो गया, लाइफ चेंज कर ली अपनी। और अब ब्लड प्रेशर थोड़ा सा नॉर्मल होना शुरू हुआ है, ताकि मैंने काफ़ी चीज़ें अपनी ज़िंदगी में से ख़त्म कर दी हुई हैं।
टेंशन? Do you mean tension?
यस सर, टेंशन की वजह से बहुत बीपी मेरा हाई रहता था, समझ नहीं लगती क्या करूँ प्रॉब्लम की।
Okay. So this, in short, this man was saying that he is just 25 years old, and 2 to 3 months back he was diagnosed with early hypertension, and on asking and taking history, the main issue was why this man having blood pressure in just 25 years old. The main reason was he was taking tension, which was his personal life tension. So the number one, blood pressure in early stage due to tension, and the number two, when the blood pressure diagnosed in this stage, in this age, another big tension. So tension and tension. So result is zero. So what you want to tell the young people? Yes. What you want to tell the people? Yes. Yeah. So now one of our staff man is going to check his blood pressure, so we can tell you that before it was like 160, 150. 2 months back, and now we can check. So like he changed his daily lifestyle. He stick with exercise, stop taking salt, stop taking fatty food, junk food, and he maintain his timetable. So let's see what's the normal blood pressure of this man this time now.
120 to 80
120 by 80. Thank you.
यार ये बीपी का मसला बहुत आम सा हो गया क्योंकि पहले होता था कि लोग वर्जिश वगैरह कर लेते थे तो उससे टेंशन इतनी नहीं थी। आजकल लोगों में टेंशन बहुत ज़्यादा हो गई है, चलना फिरना इतना है नहीं, बाहर के खाने ज़्यादा खाए जा रहे हैं, इस वजह से ब्लड प्रेशर का मसला ज़्यादा हो रहा है। तो लिहाजा ये है कि चाहिए कि हम को थोड़ा सा रिलीव करें, माइंड अपना फ्रेश रखें, वॉक वगैरह करें और डाइट का खास करें।
Yes, yes. Yeah, we all, especially viewers, also agree. Like we should not to eat too much salty food, junk food, and not to stay like couch potato and pass a sedentary lifestyle. We must get rid out of this sedentary lifestyle. So, at the end of this topic, the high blood pressure is going to be common in young people, especially now. The patient, Zishan, he is telling what message you want to give to the young people.
सर मैं तो यंग पीपल को यही मैसेज देना चाहूँगा कि अपनी लाइफ में अब ज़्यादा से ज़्यादा आप वॉक रखें और वर्जिश करें, बाहर का खाना पीना कम करें ताकि आपका बीपी वगैरह नॉर्मल रह सके, और टेंशन लेना छोड़ दें, टेंशन को इतना पीछे छोड़ दें कि ताकि कोई पकड़ ही ना सके उसे। ये इस तरह से आपकी लाइफ भी सेफ रहेगी, और बाहर से खाना पीना, नमक की परहेज़ वगैरह, और स्मोकिंग करना छोड़ दें। सबसे बड़ी बात ये आप लोग छोड़ेंगे तो आप नॉर्मल रहेंगे और अच्छी लाइफ, सेहत वाली लाइफ गुजारेंगे।
So the first thing is especially we are making videos for the common people who doesn't know about the basic things about blood pressure. So first of all, we should know what is a normal limit of blood pressure. So according to medicine, before 50 years, the normal blood pressure around 120 by 80, and after 60 years old, 140 by 90 is your blood pressure. So we have a systolic blood pressure, that is the upper one. When we are checking blood pressure, we are checking first the systole, and the lower one is diastole, systolic and diastolic. So the systolic 120 by 80, that is diastolic. So in young people below 50, below 60, the normal is 120, 130 by 70 and 80. And after 60, the normal blood pressure around 140 by 90. Yes. So now I am making the whole discussion short. We were talking about three things. Can we cure the blood pressure without medicine? And when to check the blood pressure, and what is a normal limit or value of the blood pressure? Yes. So the answer for the first question, yes. When there is nothing major association like diabetes, heart related problems, or cholesterol, or smoking, so you are diagnosed with blood pressure. So then the very early stage of blood pressure, if you want to stop or control blood pressure, if you don't want to take medicine, so you must stick with conservative measurements, which include Lifestyle modification. Yes, viewers. Lifestyle modification. Lifestyle modification is not the first medicine only for high blood pressure. Lifestyle modification is the first medicine in all type of disease. So change your lifestyle. Now, as we are talking about high blood pressure, so for lifestyle modification in high blood pressure, number one, walk 30 minutes per day. Anytime you must walk fast. You must walk fast. And number two, stop taking salt. At least reduce the amount of salt. Number three, drink purified, boiled, filtered water. Drink adequate. And number three and four, stop taking tension. Stop eating fatty food. Stop drinking. Stop smoking. Or if you can, so just reduce the amount. Inshallah, you will see the result. Whatever the disease you have, if you stick with the lifestyle modification, inshallah, you will be absolutely fine. At least your medicine will be reduced. Thank you for watching. See you next time. Yes, and one more thing. If you have questions like my blood pressure is this, what should it be, and when should I check, and what should I do to stop the medicine, you can stick with me and put your comments or question in the below comments. So I will try my best to arrange my time and talk with you, discuss with you, and reply of your question. Well, viewers, as I told you, today is a topic about blood pressure, and I will try to cover almost everything about the treatment, natural way. So, the more detail, like medications are just one way to lower your blood pressure. Explore additional options like exercise, potassium, dark chocolate, improving your sleep, and garlic. Also discover substances to cut back on like sugar and alcohol. And you must know high blood pressure, hypertension is called the silent killer. And sometimes it has no symptoms but is a major risk of heart disease and stroke. And the disease are among the leading cause of the death in the United States, and almost half of the US adults have high blood pressure. Your blood pressure is measured in millimeter of mercury. Well, as I told you, it's 120 by 80 is considered normal. Okay, so more now I am going to tell you the 17 effective ways to lower your blood pressure. So the number one, in short, increase activity, lose weight, cut back on sugar, eat more potassium, eat less processed food, stop smoking, reduce stress, try meditation or yoga, eat dark chocolate, try herbs, get restful sleep, more eat garlic, eat high protein food, take blood pressure lowering supplements, drink less alcohol, cut back on caffeine, take prescription medication. So let's talk about one by one of these 17 factor ways in detail. So number one was increase activity and exercise more. What I mean a meta-analysis of 65 studies suggests that aerobic and resistance exercise can significantly lower blood pressure, especially for men. In a 2012 study, sedentary older adults who participated in aerobic exercise training lowered their blood pressure by an average 3.8% systolic and 4.5% diastolic. So these results are as good as some high blood pressure medications. As you regularly increase your heart and breathing rate, over time your heart gets stronger. Activity, every single step of your activity, especially walking, running, make your heart stronger. And in every single step, increase your lifespan. So as you regularly increase your heart and breathing rates over time, your heart gets stronger and pumps with less effort. This puts less pressure on your arteries and lower your blood pressure. And how much activity should you strive for? A 2019 report by the American College of Cardiology and American Heart Association advised moderate to vigorous intensity physical activity for 40 minutes, 3 to 4 times per week. 3 to, if you cannot do 7 days a week, you can do 3 to 4 days a week, 30 to 40 minutes. If finding 40 minutes at a time is a challenge, there may still be benefit when the time is divided into 3 or 4 or 10 to 15 minute segments throughout the day. The American College of Sports Medicine makes similar recommendations. But you don't have to run marathons. Increasing your activity level can be as simple as using the stairs, walking instead of driving, doing household chores and gardening chores, going for a bike ride, playing a team sport. Just do it regularly and work up at least half an hour per day of moderate activity. One example of moderate activity that can be big result in Tai Chi, a 2017 review on the effective of Tai Chi and high blood pressure shows an overall average of 15.6 mm drop in systolic blood pressure and 10.7 mm high drop in diastolic blood pressure compared with no exercise at all. So exercise include aerobic exercise, resistance training, high intensity interval training, short bouts of exercise throughout the day, walking 10,000 steps a day. Okay, the number two, it's about losing weight. So let's talk about in losing weight in detail. Yes, if you are overweight, losing 5 to 10 pounds can reduce your blood pressure. Plus, you will lower your risk of other potential medical problems. A review of several studies reports that weight loss diet reduced blood pressure by an average of 3.2 mmHg, diastolic and 4.5 systole. Number three, cut back on sugar and refined carbohydrates. Many studies show that restricting sugar and refined carbohydrates can help you lose weight and lower your blood pressure. Sugar, especially fructose, may increase your blood pressure more than salt, according to a 2014 review. A 2020 study that compared various people's diet found that for people
who with more weight or obesity, low carb and low fat diet lowered their diastolic blood pressure by an average about 5 millimercury and their systolic blood pressure 3 mmHg after 6 months. Another benefit of a low carb, low sugar diet is that you feel full longer because you are consuming more protein and fat. Okay, and number four, eat more potassium and less sodium. Here is the only one you have to cut. Stop sugar, get rid or stay away from diabetes. Stop sodium, get rid or stay away from high blood pressure. Increasing your potassium intake and cutting back on sodium can also lower your blood pressure. Potassium is a double winner. The effects of salt in your system and the tension in your blood vessels, however, diet rich in potassium may be harmful to people with kidney disease. So talk with your doctor best before increasing your potassium intake. Well, low fat dairy foods such as milk and yogurt, fish, fruits such as banana, apricots, avocados, and oranges, vegetables such as sweet potatoes, tomatoes, greens, and spinach. The National Institute of Health recommends reducing salt intake using the DASH dietary approaches to stop hypertension. The DASH diet emphasizes low sodium food and eat more fruit. More fruit and vegetables, low fat dairy products, whole grain, fish, poultry, and beans. Very less, sometimes fewer sweets and red meat. Number five, eat less processed food. Most of the extra salt in your diet comes from processed food and foods from restaurant, not your salt shaker at home. The popular high salt includes deli meat, canned soup, pizza, chips, other processed foods include such high salt. The food labeled low fat are usually high in salt and sugar to compensate for the loss of fat. Fat is what gives food taste and make you feel full. See, cutting down on your even better cutting out. Make it a practice to check nutrition label. And then number six, please stop smoking. It can be difficult to do, but it's worth. Stop smoking is good for your all around health. Look, smoking causes an immediate but temporary increase in your blood pressure and increase in your heart rate. In the long term, the chemicals in tobacco can increase your blood pressure by damaging your blood vessel wall, causing inflammation and narrowing your arteries. The hardening arteries can cause high blood pressure. In the long term, the chemicals. Number seven, reduce excess stress. Yes, we live in a stressful time. Workplace, family, demand, national, international politics, they all contribute to stress. Finding ways to reduce your own stress is important for your health and your blood pressure. There are a lot of ways to successfully relieve stress, so find what works for you best. Deep breathing, take a walk, read a book, or watch a comedy. Listening to music daily has also been shown to reduce systolic blood pressure. A 20-year study showed that regular. Okay, the number 8, try meditation or yoga. Mindfulness and meditation, including, have a long been used. Transcendental meditation, yoga, which commonly involve breathing control, posture, and meditation technique, is effective. Number 9, eat some dark chocolate. Yes, chocolate lovers, dark chocolate has been shown to lower blood pressure, but the dark chocolate should be 60 to 70% cocoa. A review of studies on dark chocolate has found that eating 1 to 2 squares of dark chocolate per day may help lower the risk of heart disease by lowering blood pressure and inflammation. The benefits. And number 10, try these medicinal herbs. Herbal medicine have long been used in many cultures to treat a variety, but the problem is try to find the fresh real herb, like a black bean, cat's claw, celery juice, Chinese hawthorn, ginger, and sesam's tomato extract, and tea, umbrella tree bark. Number 11, make sure to get good restful sleep. Your blood pressure typically dips down when you are sleeping. If you don't sleep well, it can affect your blood pressure. People who experience sleep deprivation, especially those who are middle-aged, have an increased the risk of high blood pressure. For some people, getting a good night's sleep isn't easy. These are some of the many ways to help you get restful sleep. So try sitting, a regular sleep schedule, spend time relaxing before bedtime, exercise during the day, avoid daytime naps, make your bedroom comfortable. And number 12, eat garlic or take garlic extract supplement. Number 13, eat healthy, high protein food like fish, salmon fish, canned tuna, and chicken breast, beef, beans, nut butter such as peanut butter and cheese. Number 14, take these blood pressure lowering supplements: omega-3 fatty acid, whey protein. This protein complex derived from milk may have several health benefits. Magnesium. Number 15, drink less alcohol. Number 16, consider cutting back on caffeine. Number 17, take, if so, must always take a prescription medication. If your blood pressure is really very high and doesn't decrease after making these lifestyle changes, your doctor may recommend prescription medication. Okay, they work and will improve your long-term outcome, especially if you have other risk factor. If your blood pressure is only due to tension, no associated major risk factor, or no associated like diabetes, renal impairment, or high cholesterol, so you needn't to stick with medicine, maybe for a while, but try these 17 effective natural ways to kill the blood pressure. Talk with your doctor about possible medication and what might work best for you. They work and will improve your long-term outcome, especially if you have other risk factor. However, it can take some time to find the right combination of medication. So at the end, talk with your doctor. Don't prescribe or don't take medication counter product by yourself. Thank you, and see you next time with more detailed videos.